So we're going to do a similar thing as we did with side bending for rotation, especially in seated. Now we're going to have you twist backwards to your right, right on, and twist backwards to your left. And if we were to compare them, the right rotation from here looks a little bit better. Does the right rotation feel better? Yeah. Okay, so sometimes feelings and findings don't always match. Now, if I were to do this passively and have no visual relief, your arms are crossed, sweet, right? We want to make sure that we grab elbows. Oh, don't, it's okay. No need to be sorry. Right now here, I can rotate her farther than she'll go. Now, if you pay close attention on the video, if you can see her leg on the table, I'm going to roll her leg. Look how far she can go. She can go so far. She can go so far, right? Now, if I'm doing it and following and looking for sensation, I'll miss that visual cue. Now, if I go the other way, right? Now, obviously, there are times when the preference is to have the patient on the end of the table, depending on the width of the table. They may or may not be able to straddle it, especially if they're having other concerns, right? Now, this is more restricted, but if I do it wrong, look how far she goes, right? People will say, well, you have to stay on axis. Well, if I'm looking at the top of her head, I may not know I'm off axis. If I can't see her leg, right? So her leg's already moving. So if I'm doing this right and I see that leg move, I know that there's some dissociation. But I need some kind of level line. I need visual cues. The table ends up being a really good visual level cue, but rotation, to be able to see it and know which way they rotate well and which way they rotate poorly, literally just stand behind them with enough visual relief that you can see it and have them twist themselves. There's too many problems with doing that passively. You will feel restricted areas. I definitely feel some stuff in the ribs on the left side as I rotate her. But it doesn't mean that I know what's going on necessarily. I just know that there's restriction there. And if I don't compare it properly to the other side, if I don't have appropriate reference points, I'm not going to know as well what the heck is going on. So I want to make sure I know what the heck is going well, what's going poorly.